afternoon. My name is Paul Pettit. I'm the Public Health Director for Genesee and Orleans County. And we're here again at 4 o'clock for our daily press briefing. And today we decided to do a live press briefing to discuss and share some of the significant increases in numbers that we've been seeing the past couple days and going into from last weekend. So we thought it might be a good opportunity to talk a little bit more directly to our residents around why some of these increases are occurring and some of the, again, important things that we need to do to make sure that we're protecting ourselves and protecting others during this time. So what I'm going to do is what we typically approach these. I'm going to start with our situational update, and we're going to talk through some of the numbers. Again, I have some general information on other things that I'd like to share. And then Jay Gazelle is going to come on. He has a few updates from the county operations perspective and different input that he wants to share. And then we'll be opening it up to the media for any questions relative to today's briefing or other questions that they may have. So at that time, the media will be unmuted and they'll have the opportunity to share and talk about any and ask any questions they may have. So as of 2 p.m. today, again, our cutoff time period is 2 p.m. Genesee County has received 10 new positive cases of COVID-19 for a total of 44 cases. So again, that is 10 new for today. So that's on top of the 10 we received yesterday. Of the new ones, 7 are under the age of 65 in the central part of Genesee County. 3 are under the age of 65 in the eastern part of Genesee County. All 10 of the positive cases were under precautionary or mandatory quarantine when they became symptomatic and were thus swabbed. So again, these are all known contacts and known direct contacts of other cases that we were already aware of. So there is no new additional cases from the general community that we were not monitoring to this date. In Orleans County, we have 2 new positive cases of COVID-19. So again, a total of 17 now in Orleans County. One of the positive cases is under the age of 65 and lives in the eastern part of Orleans County. The other one is under 65 and resides in the central part of Orleans County. One of the positive cases was under precautionary or mandatory quarantine when they became symptomatic. So one of them, again, was a known case, and the other is a new one that has been reported to us. Of those cases in Genesee County, 1 is in the hospital, so 1 of the 44 is in the hospital, and in Orleans County, 2 of the 17 are currently in the hospital. Contact tracing has begun for all the new positive cases, and ongoing contact tracing continues for any of the other ones where we're still investigating and trying to identify close contacts after the person became symptomatic. And again, the guidance here has changed a little bit for contact tracing. We are going back 2 days now. Again, that's 2 days from when symptoms began. That has changed a little bit. At one point, we were doing day of symptoms. So again, I think this is reflective of the understanding of the virus a little bit more, that folks can pass this virus while being asymptomatic or have mild symptoms to the point where they're not identifying it. So again, we're going back a couple days now and including those folks in direct contacts when we do contact tracing. If a person is identified as a contact, the health department will notify them. They will be quarantined and they will be monitored for that 2-week period, and they will be swabbed if indicated if they become symptomatic. Again, we're still providing limited information on those positives, again, in lines with HIPAA regulations. And we again we've been talking about this quite a bit. We want people to focus on the fact that there is community spread. Not necessarily the locations of the positives is really what we need to be focusing on. We need to adhere to the guidelines, minimize our activities out and about, and make sure that we're practicing the precautions that we've been talking about. When we have community spread throughout all of our areas throughout the county, again, the location of the positive is not the focus. I understand that there's still a strong desire for people to get that information, but again, we have to protect the information of those who are positive in their healthcare information, and we are balancing that, and we're making sure that the public is getting the vital information they need to make sure that they're being as protected as they can be. So again, if and when a location is needed to be publicly announced due to the fact that there is uncertainty around the direct contacts, if the person was in the community, we will be asking, similar to what you may have seen in other counties, with them asking and reporting out if you've been to X location at X time to report to the health department. So again, that will be done if needed. To date, we've been able to, we felt very comfortable that we've been able to identify all the close contacts. So again, that will occur if we need to, if that situation arises. So again, cumulatively overall, just I'm going to run through the numbers, and our mapping system that we launched last week is being updated with all this current information. So we'd encourage you to go there and continue to monitor that on a daily basis as we update those numbers. But in Genesee County, we have 44 positives. We have 291 negatives. 33 people are under mandatory isolation. 38 people are under mandatory quarantine, 1 under precautionary quarantine. We've had the 1 reported death, and we've had 10 people now who have recovered. So again, we're tracking all those numbers across that line, and they are on the map. In Orleans County, we have 17 positive cases, 177 negative, 13 under mandatory isolation, 26 under mandatory quarantine, 2 under precautionary quarantine, and 4 have recovered. So again, that's our snapshot of updates on the total numbers that we have going, and again, that is available on the map. So one thing we want to talk about really directly with our residents here is the fact that our local numbers are increasing significantly. We've essentially, in Genesee County specifically, doubled our cases in the last couple days. And I know that this can be alarming and may provide some anxiety for folks looking at that kind of information. We had been talking all last week in our press briefings and the releases that we had, and I talked about it last Friday, that the health department and those in the health field were fully expecting to see an increase in numbers heading into this week and next week, just due to the fact that we're a couple weeks in the lag behind what we've been seeing downstate when they started to have their cluster of cases. So the increase is not unexpected. What we do want to do is make sure that people are fully aware and well prepared and practicing the guidance and adhering to it to keep this increase as minimal as we can. Obviously, the more we practice social distancing and we adhere to the guidelines overall, hopefully the lower numbers that we're going to see, because the whole goal here is obviously mitigation and trying to keep people apart to keep our numbers from increasing. So, again, these numbers are expected. We do expect to continue to see them decline, hopefully not at the rate of 10 per day or 6 per day, so to speak, in Orleans, what we saw yesterday. But we do expect to see that continual climb as we move forward. This is also reflective of increasing community spread, as we've been talking about for the last several weeks now, and the fact that many people are not practicing social distancing and adhering to the guidance that has been put out there. We are constantly getting calls at the health department. We are getting calls from the general public, by elected officials, by others reporting that businesses, the individuals, they're continuing to gather. They're continuing to not adhere to the guidance that is out there. And we can't stress this enough, that in order for us to keep our cases minimal, to reduce the negative impact on our communities, and to help reduce and minimize how long these restrictions are going to be in place, we have to do our part. And as your public health director, as I know all the elected officials and others that we are constantly in contact with, we're asking you all, we're asking the public to do their part, even if it's painful, even if it's something that you don't want to do, maybe you don't really believe and want to hear that this is a significant issue for us. We all are in this together. We live together, we play together, we work together, and this is something that we all have to be part of in order to make it successful and continue to flatten the curve and push this out so that we don't have such a spike in cases. So I can't stress that enough. Staying home is one of the best defenses against, the spread of COVID-19. If you don't have to go out, don't go out. If you do have to go out, take the precautions that we've been talking about, and I'll be mentioning a couple of them in a minute here. But we need to limit contact with others as much as we can during this time, especially over the next couple of weeks specifically, when we're seeing such an increase in local cases. All right, so a few things about going out, some recommendations for folks, because again, we've been getting a lot of questions around this, and we thought it's important to address this to hopefully give some additional guidance to people. If you have to go out, right, so you have to get groceries, you have to pick up prescriptions, there's different things that life still has to go on at some level. We want to make sure that the people that are going out and doing these tasks are the ones that are hopefully the best fit and potentially able to be out and about, right? So we talk about our high-risk populations, our elderly, our senior populations, those that are immune compromised or with underlying health conditions. Those are the folks that we hope for the most part can stay in and not have to be out and about during this time. So if you have to go out, make sure only one member of your family is going out to get supplies. We're getting a lot of reports. I've witnessed it firsthand myself, going to different local grocery stores and other areas to purchase things. There's whole family units out and about. This is not the time to go out and shop and spend the day out and about with your family. Again, try to just have one person go out to the store, get what's essential, head back home. Make your list ahead of time to make sure you're limiting exposure while you're out at the stores. Again, while you're in the stores, make sure you're maintaining those 6-foot separations. I know a lot of the local establishments have hand wipes and other things available to wipe down carts, to wash your hands. Continually do that throughout the entire time. Again, minimize purses and bags and other things that you may be bringing into the store, because again, those are items that could be contaminated potentially. It's everyone's social and civic responsibility to protect themselves and others. And during this time, especially in the next few weeks, I can't reiterate that enough. It is everyone's responsibility to do this. Businesses and employers, again, we're dealing with some issues, again, around employees showing up to work while they're symptomatic. This is very concerning to us. Obviously, the guidance that's out there is very clear that you should not be out of your home, number one, but much less working, even if you are an essential business. We do not want folks out and about and working if they are symptomatic. So this means they need to stay home. They need to call their healthcare provider. Don't just show up at the office. Don't show up at the urgent care of the hospitals. Call ahead, and hopefully we can get you swabbed and find out what's going on. So again, it's very important that the businesses apply and follow the guidance, that they're making sure they're being responsible for their employees as a business owner. It's one of your responsibilities to protect the health and safety of your employees. So make sure that you have put in place the different guidelines and guidance that's out there to protect your employees, which will ultimately protect them and their families and others in the community, when they're home and out and not at the workplace. So again, stay home if you're sick. That's the biggest thing that we can continue to say, and make sure that there are some different measures in place to, again, put in the different guidelines and practice social distancing and enhance cleaning and all the other things that we know are very important during this time. Again, the governor has established the New York State Pause Enforcement Task Force. So that is a number that we've been putting out in our daily briefings. And again, this is available for anybody in the public. There's a website. There's a 1-800 number that's available 24 hours a day, 7 days a week, that we are sending folks to if you see a business that happens to be open that's not complying with the guidelines, or if, again, there's gatherings that are occurring that may be of concern, where there's multiple people, out hanging out and doing and gathering well beyond what the guidance is. So again, we're encouraging folks to call that number, and there will be follow-up as a result of that, again, to the business, or potentially breaking apart some of those gatherings. So again, that is out there. If you are an employer and you believe your employee may be violating some of these different rules and regulations, there is again guidance out there to contact the New York State Attorney General's office, and a website available that, again, you can contact. And all this information will be part of this report that will be made public. So again, you'll have those numbers and those websites. Obviously, there's been some changing guidance around using face coverings or masks. So again, this is evolving. If you look back a couple weeks ago, the recommendation, again, was around not wearing those, and a lot of that was driven not that they weren't helpful potentially, but also with the shortage that's out there. So again, that has been evolving, and obviously the federal government through the CDC and even down to the state now and localities, there's a strong recommendation for anybody out in the general public to wear some level of a face covering when they're in the stores and in contact with other folks. So again, there's a lot of guidance out there on what a face covering is and recommendations how to potentially make your own mask, because again, the availability to get them is not really readily available. So we would encourage folks to consider doing that. And as we've talked about many times in these different press briefings, the mask is to protect others from you. Again, if you think about when you're talking, there's some spray, there's spit coming out, and again, those are droplets that if you are positive or you're shedding the virus, you can pass that to others. So the idea is with a mask, you're containing that, right? So you're minimizing the exposure to others. This is not an N95 mask. This is not fit tested. This is not protecting you from the virus. Again, any barrier is better than nothing, but we don't want anybody having a false sense of security that if they have a face covering on, they're invincible and they won't get the virus. So again, there's a lot of recommendations out there on masks, homemade masks. We've heard of a lot of great stories coming in of people making masks for different people and providing those. So again, there's seems to be some more readily available for folks. So again, that is a new recommendation that we would encourage folks, if they have access to them, to consider wearing those masks when out in public. So again, we need to focus on stopping the spread in our communities. Follow the guidance from authorities where you live. Again, we're trying to provide this as readily as we can every day through press briefings. There's a lot of information still flowing out, national news, state news, local news. It's all out there. A lot of it's very relevant and very trustworthy. Again, we're reporting our local data because we want to make sure you're hearing from us directly here in our counties. But, adhere to that guidance. We are taking this very seriously. This isn't something that anybody should be taking lightly. I mean, we're talking about, significant spread if people are not, adhering to the guidelines. So, again, it's very important that you follow all the different, different recommendations that may be out there. As always, I want to make sure that we're pushing out and focusing in on the mental health aspect. Obviously, we've talked about this quite a few times, that during these difficult situations with folks having to stay home, it can increase anxiety, it can increase other behavioral and mental health issues. So it's very important that if you're feeling anxious, you're feeling any level of need to talk to somebody, there are services that are available. We've posted that information. Obviously, our local mental health departments, there's other behavioral health agencies in our communities, along with the Care and Crisis helpline that is available 24/7. So we want to make sure that you're not alone and you're not abnormal if you're feeling anxious and just uncertain during these times. And don't feel that you can't talk to people. There are people that are available for you. We want to make sure that you're reaching out to them so that you can get the help that you need. The last thing I just want to say real quick before I turn it over to Jay for a few comments is, this is Public Health Week. Fitting enough, we're here in a public health emergency in a pandemic, and I just wanted to just take a quick second that our workers, the folks down the hall from me right now in both of our counties and around this state and country are working tirelessly with the healthcare workers, with the first responders to do our best to protect our communities during this time. And we're not always out in the front necessarily. A lot of the activities and the things we do are in the background. Obviously, we provide education, but the regulatory piece and making sure our folks in our communities are protected as best we can for our residents and our visitors that come here on a regular basis. But I just want to take a quick second just to remind everybody, it is Public Health Week, that each one of us makes choices, right, regarding the orders that are available, the guidance that's out there. It's incumbent upon all of us to do our part. Public health is not about a person. It's not about an agency or a government bureaucracy doing their work. Public health is about all of us together in our community. We're going to be as healthy as we're going to be. We're going to be as sick as we're going to be as a result of the actions that we take today, as a result of the way we come together and look at this as a community-wide issue. So I again call on every single one of you that we are all public health. We're all in this together, and we need to take this very seriously and make sure that we adhere to the guidelines and the guidance that's before us so that we can get through this difficult situation in front of us as quickly as we can. So with that, I'm going to turn it over to Jay. I know he has a couple comments, and then again, we will open it up to the media for questions. Thank you.
Oh, thank you. Again, thank you very much. What we're trying to do is, obviously, as the governor is telling us every day, and also at the federal government level, we need to flatten the curve, and we also need to continue to practice all the social distancing and safer at home mantra that is coming out. Three or four of the services, Paul just mentioned mental health and what's out there as far as our care and crisis hotline is concerned. Our Children's Advocacy Center is, as always, there on behalf of the children. Sadly, unfortunately, during these times of isolation and social distancing, home may be the most dangerous place for some of these children. That is why our CAC is out there, but also that's why one of the things that they're recommending people do is called the New York State Child Abuse Hotline, 1-800-342-3720. And that can mean to make the difference between life and death for an at-risk child. Once again, that's 1-800-342-3720. Also, in regards to the Department of Social Services and the programs and services that they offer, they are still accepting applications, both through the mail and through the drop box that they have. They are also starting new recertifications and continuing those through phone calls through our Department of Social Services numbers. We've put those out previously, both in terms of at the county buildings, but also out on the internet and on our county website, with regard to your ability to continue to be part of our system and not letting people fall through the cracks. Again, the Department of Social Services, as is the County Mental Health Department. If you go to the Dropbox, it's located at 5130 East Main Street here in the Batavia, town of Batavia, just east of the National Grid shop, the location that's there on Route 5/Main Street. Third thing is also with regard to the significant number of Fed stimulus programs that are coming out right now. Our County Job Development Bureau, Teresa Von Son and Company, again, can be reached again through our county website, as well as through the phone number that was published earlier. Also, in terms of what UI benefits, we understand that the system itself is massively overloaded, both at the state level and at the federal level. But again, the idea is that if you make that first contact, that will also help us be able to target what benefits and what programs people may be eligible for, particularly in these times when there's been a significant dislocation as far as the workforce itself is concerned. Again, also in terms of helping, I know Paul mentioned the issues with regard to what the state has put out as far as essential versus non-essential businesses and their ability to function in the community, and what we're dealing with in terms of trying to push down the number of violations as far as gatherings and non-social distancing and things of that nature. We continue to get more and more guidance every day from the state of New York and also from our district attorney, as well as our law enforcement partners across the county. You know, in the village of Leroy, the town, the Corfu, as well as the county sheriff's department and the city of Batavia Police Department. So again, as Paul indicated, we're all working together, trying to make the best of a not so great situation. And it's all about partnership and teamwork, folks. And that's what we're here to do, both as county government, city government, and all the local municipalities, villages and towns across this county, and particularly with regard to what's going on here, and most apparently, and particularly what's going on with regard to county health department and following up. And you see the statistics that are up on our new website as far as the public health department is concerned. And I guess the final word, which, you know, for me is not an easy thing to do, is if you see something, say something. Let people know what's going on out there. Call these hotline numbers if you need to. Get in touch with the local authorities. Again, with regard to social gathering, the issues with regard to problems of people still congregating, and the prospect that community spread is now upon us. Thank you.
Okay, thank you, Jay. We're going to open it up to the media. We are having, unfortunately, some difficulty again getting some of the sound coming through. It's choppy. So as we unmute the media folks, hopefully we can understand the question. If not, we may need you to type it into the chat box so that you know, my assistant Mary here can you know, relay that question to me. And we'll do our best. If for some reason we can't understand it or get it, we can obviously answer those offline for any follow-up questions you may have. So Mary's media right now, so feel free to ask questions. Just make sure you identify yourself, and we'll be able to answer those questions. Thank you.
This is Dan Fisher from WBTA. Could you elaborate on the comments you made about what would appear to be an alarming statement that we have doubled our cases in 2 days? You made some comments to help alleviate some of the anxiety that the public may be feeling about that. And secondly, do you agree that New York City, based on the data we have, is indeed seeing a plateau. Therefore, could we see it in 2 weeks?
Yeah. So, sorry, Dan, I couldn't catch most of that question. I knew it was around some of the anxiety and seeing the increases that we've been having locally. You know, if you want to type your question in, Mary can relay it a little more clearly. But, you know, obviously, as I mentioned, we have been seeing this level of increase, and we've been talking about potentially seeing this level of increase. Again, 10 cases is not the amount that we want to see by any stretch of the means. You know, and unfortunately, you know, again, a lot of what we've seen in the last 2 days, these cases is around human behavior. A lot of this has been driven by, you know, folks out and about, working, gatherings where people are symptomatic. And again, I spent a lot of time just a few minutes ago stressing the importance of making sure that if you're symptomatic at all, you're staying home. You're not out and about, you're not going to stores, you're not gathering other folks, you're not at your employment. Because again, this virus is prolific. It you know, is spread fairly easily. We know that you know, the initial R naught, which is around, you know, how many other people can be infected potentially, is a little over 2 at the moment. So again, every individual that's positive is going to affect potentially another 2 individuals. So you know, it's very important, you know, as these numbers climb. You know, we understand that people may be anxious and concerned about that, but again, we have been expecting to see this increase, again, following what we saw downstate with their rise in numbers, and they were doubling cases every day, every couple days. Obviously, that seems to be in kind of the similar realm that we are in now. We're very hopeful that the social distancing that we've been doing for over 3 weeks now is going to be very helpful in us not climbing as quickly and seeing less cases, you know, over that same time period, because we have folks apart. We took fairly early on an aggressive means, obviously, to get the schools closed, to get other businesses minimized, and trying to reduce, you know, the exposure to one another. So we're hopeful that, you know, as we do see these increases, that overall our numbers are not going to spike, obviously, as high as we've seen in some of the downstate counties. Even proportionally to population, and that you know, and that goes back to just being so imperative that we have folks stay in, self-isolate. If again, contact your provider ahead of time, and you know, just do our best to social distance during this time.
So WBTA asks, do you agree New York City is seeing a plateau, and we lag them by 2 weeks? Can we expect a plateau in 2 weeks?
Yeah, so I mean, we can't speak to that specifically. I think if you look at the data, it does appear that New York State seems to be plateauing a bit, just based on the number of reported cases. And again, if you look at the time frame, I think that would be reflective that we are lagging 2 to 3 weeks behind them. But I don't want anybody to have a false sense of security, and we shouldn't really be focusing on a time frame per se. We need to focus on what we can do now to make sure that we're limiting those numbers, right? So again, we don't know fully what's going to happen downstate. Again, if you look around the world at other countries that have had previous you know, incidences and outbreaks with this prior to the United States, we seem to be on a similar trajectory if you look at peaks and apexes. So again, we're hopeful, and we're going to hope that the next 2 to 3 weeks for us will be the apex. But keep in mind, even after our apex, we're still going to see cases, we're still going to see spread, and we still need to maintain and work and do our best to minimize that exposure throughout our communities.
Howard Owens with the Batavian. Can you hear me okay, Paul?
It's okay at the moment, Howard. Go ahead.
All right. I have a few questions. And some of them will be from a reader. I'll let you know when those are. But first of all, with the number of cases, and especially such a rapid amount of cases, are you confident that you have a handle on the contact tracing? And at what point are there too many cases for you to continue contact tracing?
Yeah, so I think I got most of that. So you said on increased cases, are we comfortable with the contact tracing at this point? We do feel we've you know, identified most of the close contacts again for the most recent increase. As I mentioned, the new 10 new ones today that we had in Genesee County were all folks that we already had under observation, so to speak, under mandatory quarantines. So what happens in that case is now we have to look out to each individual one of those of their close contacts. So again, that process is ongoing, but we still feel we have a fairly good handle on the containment. It's fairly new. Obviously, we just found out about these cases about 8 hours ago, so it's still a little bit early in the investigation. And again, it goes back to the fact that at some level, it goes back to the simple fact that if you're symptomatic, you need to stay home. And, you know, even potential contacts with these folks, again, they need to be home if they're symptomatic and, you know, practice all the basic precautions we're talking about.
Okay. I realize, you know, what you're trying to do with HIPAA and privacy and everything. It seems like there's a number of cases under 65, and that combined with the issue, you know, that you raised about people aren't practicing social distancing enough, that you're getting a lot of complaints along those lines. I'm thinking it might be helpful for the public to know more detail on the age range, because I think, like the governor talks about all the time, you know, young people tend to think they're Superman, and they're not. They can get this too. And would there be an opportunity for you to give us a better handle on, like, within a decade span for each age group, what you're seeing in infections?
Yeah, sorry, Howard, that was really choppy. I don't
You know
know
what? I'll try again. I'll try again. I should have muted the output sound so there's no echo. Can you hear me better now? So I was asking about ages, and again, the idea that you know, the governor's talked about younger people thinking this can't affect them, but we've had so many people under age 65. We have no idea if there's in their 20s, 30s, and 40s, and that might be helpful for people to remind them that they could get it too.
Yeah, sorry, Howard. I mean, if you can chat in real quick, the general gist of the question, I believe you're asking about the ages of these different individuals. So, you know, we are working on doing a little deeper dive. I mean, obviously, we know the ages of these folks, but I think the important thing and the reason we're going to start sharing a little bit more of those age brackets is, number one, our cases are climbing. So we feel a little more comfortable with releasing a little bit more information on these cases, but also I think maybe the point you were getting at, I'm not 100% sure, but is that this virus is impacting all ages, right? So we talk about our highest risk pool, which again are our elderly folks, those immune compromised, and those with underlying health conditions. But we do know that many of the cases that we've been seeing are in younger folks at all the different age brackets. So no one is immune from this virus. It doesn't, you know, preclude anybody from getting ill, which is why it's very important. I think what sometimes is lost in translation here is that 80% of folks will have mild symptoms. Again, that has not changed. So those are our healthy folks, but there are several people within these younger categories that are becoming sick, obviously, that are positive. And again, depending on their underlying health issues, there is, as we know from earlier, a percentage of those folks who have been hospitalized and actually some deaths. I believe one of our neighboring counties, there was a young 20-some-year-old that passed away from COVID-19. So it is important, regardless of age. You know, no one's invincible. We're all susceptible to COVID-19, along with many other illnesses in our environment. And we need to take it seriously, again, to protect yourself and to protect others. You may be one of the lucky ones if you get it and not get overly ill. But what we don't want to have happen is you being symptomatic out and about in the community, gathering with friends, passing that along. It perpetuates the illness in our community. It perpetuates the length that we're going to be dealing with this. And it could very well lead to unintended consequences. Other family members becoming ill, maybe someone that is older, maybe a grandma or grandpa or someone else in your household that has other underlying health conditions. Again, this is not about us individually. This is about us together as a community.
Thank you, Paul. I have more questions, but it's so hard to hear. It'd be nice if there'd be a chance to follow up with you when we can communicate more easily, because this is the questions are too complicated and it's not really working out.
Yeah, sorry, Howard, I'm not picking up any of that. I apologize. If you want to type it in, if not, we can follow up with you offline with the follow-up question. I apologize about this. Are there other questions from the media that maybe we can try to decipher, or maybe you can type them into the chat box and we can try to answer them? If not, again, we can answer any questions followed up after we wrap up here, and we'd be happy to get you the answers. Okay, so again, we apologize for the technical difficulties. You know, we're continuing to work through the Zoom platform here, and the connectivity, and I believe the firewall at the county level is causing some interference as it did last time. So I know our IT folks are working hard to get that corrected. But again, hopefully you were able to you know, hear myself and Jay clearly when we are articulating the messaging for the day, and again, trying to provide some context to what's going on here locally. And as we, you know, as I wrap this up, again, I just want to emphasize that, you know, we all need to do our part, and these increases are expected. We're going to be continuing to see these over the next couple, 2 to 3 weeks specifically with, I would not be surprised to see multiple, you know, 2s, 3s, 4s every day moving forward for a while. And again, our nurses and our epi staff are on top of this. They are doing the contact tracing, and we're doing containment around these positive cases as they go on. But I'm asking you, you guys and individuals as residents of this county, in Orleans County, in Genesee County, to do your part. Help protect others by protecting yourself. Stay in if you're sick. Call ahead if you need to go receive any medical care, and make sure you're constantly washing your hands and just doing whatever you can to adhere to the guidelines. So with that, again, we'll be continuing to provide these daily updates at 4 o'clock. Again, mainly through the push method. Again, we've been providing those on a daily basis, and we will definitely be back here on Friday, hopefully with our audio fixed so that we can have better dialogue, and we'll talk to you then. So stay safe out there and make sure to protect yourself and protect others. Thank you.